Causes and risk factors of borderline personality disorder, BPD, role of childhood trauma and abuse. Childhood trauma and abuse play a significant and well-documented role in the development of borderline personality disorder, BPD. While genetic and biological factors are important contributors, the experiences and environment in early life have a profound impact on how the disorder emerges and how its symptoms manifest in adulthood. In this episode of the Borderline Personality Disorder, BPD, podcast, we will delve into the crucial role that childhood trauma and abuse play in the development of BPD, exploring the types of trauma, the mechanisms through which they influence the disorder, and the lasting effects of these early experiences. What is childhood trauma? Childhood trauma refers to experiences of neglect, abuse, witnessing violence, or experiencing severe stress during childhood that can have lasting effects on an individual's emotional and psychological development. Trauma in childhood can come in many forms, including physical, emotional, and sexual abuse, as well as neglect, abandonment, or growing up in an unstable or unsafe environment. These traumatic experiences can overwhelm a child's ability to cope, and without proper support and intervention, they can lead to emotional dysregulation, difficulty with relationships, and a distorted sense of self, all of which are core features of BPD. Over time, childhood trauma can create patterns of behavior that contribute to the development of mental health disorders like BPD. Types of childhood trauma and their link to BPD. 1. Physical and sexual abuse. Physical abuse, including hitting, beating, or other forms of physical harm, is a significant form of childhood trauma that is strongly linked to BPD. Children who experience physical abuse may grow up with a heightened fear of abandonment and intense feelings of rage or shame, which are common in BPD. Sexual abuse, especially in childhood, is another major factor contributing to BPD. Survivors of childhood sexual abuse often struggle with low self-esteem, dissociation, and difficulties in trusting others. These early violations of personal boundaries can lead to difficulties in emotional regulation and the development of an unstable self-image, key features of BPD. Both physical and sexual abuse can create deep emotional scars, making it difficult for individuals to regulate intense feelings of anger, sadness, and anxiety, and leading to chronic feelings of emptiness and insecurity. 2. Emotional abuse and neglect. Emotional abuse, such as constant criticism, humiliation, or verbal aggression, can leave children with a deep sense of inadequacy and worthlessness. The emotional neglect of a child, where their emotional needs are not met, can also have devastating effects. In cases of emotional neglect, children may feel invisible, unloved, or abandoned, which may lead them to develop desperate behaviors to elicit attention or affirmation in adulthood. Both emotional abuse and neglect can create patterns of fear of abandonment in BPD, as children learn to distrust the stability of their relationships with caregivers. The emotional chaos and inconsistent responses they experience in childhood can lead to emotional dysregulation and problems in forming healthy, stable attachments in adulthood. 3. Parental substance abuse and mental illness. Growing up in an environment where parents are dealing with substance abuse or mental illness can contribute significantly to the development of BPD. Children in such environments often witness chaotic, unpredictable behaviors and may feel abandoned or neglected, even if their physical needs are met. The instability of such environments can hinder the development of healthy emotional regulation skills, leading to a greater risk of BPD in later life. Additionally, these children often learn to suppress their own emotional needs to cope with the unpredictability of their parents' behavior, which can lead to emotional dysfunction and difficulty in relationships as they grow older. 4. Witnessing violence or growing up in an abusive environment. Children who grow up in households with domestic violence or witness violence between caregivers are at a high risk of developing BPD. The fear, trauma, and helplessness that children feel in these situations can profoundly affect their ability to process and regulate emotions. Witnessing violence can lead to hypervigilance, where the individual becomes overly sensitive to any potential threat, even in safe environments. This heightened emotional reactivity can contribute to the emotional instability seen in BPD. Mechanisms through which trauma contributes to BPD. 1. Attachment theory and BPD. Attachment theory provides a framework for understanding how early childhood experiences with caregivers shape emotional regulation and interpersonal relationships. Secure attachment, a stable, loving bond between a child and caregiver, allows children to develop a healthy sense of self and the ability to manage emotions. Insecure attachment, on the other hand, often results from early trauma or neglect. Children who experience inconsistent caregiving or are subjected to trauma may develop avoidant, ambivalent, or disorganized attachment styles. These attachment styles can contribute to the fear of abandonment, relationship instability, and emotional chaos seen in BPD. 2. The impact of trauma on emotional regulation. One of the core features of BPD is emotional dysregulation, the difficulty in managing and responding to intense emotions in a way that is socially appropriate or healthy. Childhood trauma can disrupt the development of emotional regulation, leading to extreme emotional reactions in adulthood. Traumatic experiences can lead to changes in the brain's emotional processing systems, particularly in areas such as the amygdala, responsible for processing emotions like fear and anger, and the prefrontal cortex, which helps regulate emotional responses. These brain alterations may make individuals with a history of trauma more prone to impulsive behaviors, anger outbursts, and emotional reactivity, all of which are hallmarks of BPD. 3. Self-image and childhood trauma. Many individuals with BPD have a fragile sense of self and low self-esteem, and these issues often stem from early childhood trauma. When children experience neglect, emotional abuse, or inconsistent parenting, they may develop a poor self-image and a distorted understanding of their own worth. They may also come to see themselves as unworthy of love, affection, or care. This unstable self-image can lead to a persistent sense of emptiness and a constant need for external validation. The difficulty in defining who they are and what they value leads individuals with BPD to engage in self-destructive behaviors or unhealthy relationships in an attempt to fill the void or find a sense of purpose. 4. Learn coping mechanisms. Childhood trauma can also teach children maladaptive coping mechanisms for dealing with emotional distress. These behaviors may involve self-harm, impulsivity, or avoidance, and they often persist into adulthood, contributing to the patterns of behavior seen in BPD. For example, individuals who were subjected to emotional neglect may develop coping strategies that focus on emotional suppression, which can later manifest as emotional outbursts or difficulty identifying and expressing feelings. Similarly, a child who grew up with trauma might learn to dissociate as a way to escape emotional pain, a behavior that can carry over into adulthood and contribute to dissociative episodes in BPD. The importance of addressing childhood trauma in treatment. Given the significant role that childhood trauma plays in the development of BPD, trauma-informed care is essential in treating the disorder. Therapy approaches such as dialectical behavior therapy, DBT, cognitive behavioral therapy, CBT, and trauma-focused therapy focus on helping individuals understand and manage their emotional reactions, develop healthier coping mechanisms, and build stronger, more stable relationships. In treatment, understanding the link between trauma and BPD can provide the foundation for healing. By working through past trauma and developing new skills for managing emotions and building relationships, individuals with BPD can achieve significant improvement in their mental health and overall quality of life. Conclusion. Childhood trauma and abuse are major contributing factors in the development of borderline personality disorder. Early experiences of neglect, emotional abuse, sexual abuse, and violence can profoundly affect emotional regulation, self-image, and interpersonal relationships, all of which are central features of BPD. Understanding the role of trauma in BPD is crucial for effective diagnosis and treatment, and addressing these underlying issues in therapy can help individuals with BPD learn to manage their symptoms and lead fulfilling lives. In future episodes, we will explore the therapeutic approaches used to treat BPD, including trauma-focused therapies, and how individuals can begin the journey toward healing and recovery. Stay tuned as we continue to examine the causes, treatment, and management of borderline personality disorder.